Today we're going to talk about some nutrients that are important for optimizing your health and your baby's health during your pregnancy. Folate is a necessary nutrient for DNA synthesis and protecting our cells from damage. It's also indicated in pregnancy at higher amounts due to the growing baby and neural development. Most prenatal vitamins are kind of on the lower end of folate in my opinion. You want to pay extra attention to the form of folate and make sure it's activated folate so it's ready to use, and that form of folate is called 5-methyl tetrahydrofolate. So definitely pay attention to the actual form of folate in your prenatal. The next most important nutrient for your baby's development is omega-3 fatty acids. These are EPA and DHA. DHA is critical for your baby's brain and development of its neurological system. DHA may prevent preterm labor, preeclampsia, and low birth weight, and also help with stress resilience. And some of the prenatals, again, have DHA in it or omega-3s in it, but it's not quite high enough. The next really important nutrient is vitamin D, the sunshine vitamin. For pregnancy, I often recommend talking to your doctor to see what your levels are, to see what the appropriate dose to supplement with. Vitamin D has so many benefits for your immune system, but definitely for pregnancy, it can help prevent against high blood pressure and preeclampsia. It has also been shown to reduce the risk of premature labor and delivery. And then iron. Iron is often routinely checked at prenatal visits due to the baby's increased need for oxygen. Prenatals often have iron in them, but talk to your doctor about your levels. They'll check your ferritin, which is your storage form of iron, and if you need extra. Not only supplementing with iron is going to prevent anemia, it also decreases the risk of premature birth and low birth weight. Iron deficiency is often linked to poor placenta development and the increased risk of miscarriage. And the last supplement is probiotics. Taking probiotics during your pregnancy can help prevent against UTIs, gestational diabetes, preeclampsia, and it can help prevent against postpartum anxiety and depression. Women taking a probiotic, especially in the third trimester, can help prevent asthma, allergies, and eczema in their babies. If you found this video helpful and you want to learn more about pregnancy tips, put your questions below and I'll get to them when I can.